In health news tonight, those superbugs that are out to get us, appears us now that they are winning.
That's right. There's a disturbing new report now sounding the alarm that those antibiotics, well, they're losing their punch worldwide. News 8 medical reporter Jocelyn Memento live tonight in our New Haven newsroom with more on what's going on, Joss.
We've been hearing about these superbugs for quite some time now, and I've done a number of stories on it. But this is the first time the World Health Organization has issued a global alert on these drug-resistant bacteria. A reminder just how vigilant we all need to be. The World Health Organization is looking at these tiny microbes and seeing large-scale problems, issuing their first report on the escalating antibiotic resistance, and every country is on the list.
Here in places like the U.S., we've been on top of this for a long time.
It's nothing new to Dr. Zane Saul, Chief of Infectious Diseases at Bridgeport Hospital, where policies are in place to fight back the so-called superbugs.
We have isolation policies that have been in effect where anybody that has a resistant bacteria that gets admitted to the hospital gets placed in an isolation room, and anybody going to visit or caring for the patient wears protective gear so that they don't spread it to other patients in the hospital.
The small organisms are closely monitored in the laboratory on a daily basis.
And identifying them quickly and making sure that there's no trend and that there's no spread to specific parts of the hospital.
Antibiotics were developed in the last century, before World War II, before penicillin and other antibiotics were available. Pneumonia and skin infections were deadly. There are still antibiotics available, though limited, says Dr. Saul. But unless new drugs are developed, minor injuries and simple infections may no longer be treated.
Gonorrhea has been identified as a superbug because it no longer is killed by any oral antibiotics. And to treat gonorrhea effectively in most parts of the world, you need to use an injection of an antibiotic.
Taking antibiotics only when needed is vital, so when really necessary, lives will be saved.
The less often that you take them, the more they're going to work for you, and that you've not exposed your body to antibiotics unnecessarily, potentially allowing the good bacteria in your body to develop resistance, and that's where this all stems from.
Bridgeport Hospital is also closely monitoring its antibiotic use, making sure the drug is pinpointed for the specific bacteria infecting the patient. Washing hands also key to stopping the spread of germs. All hospitals have similar programs. Ann?